Patient Sarah Thompson, 30-year-old pregnant female, experienced an unforeseen complication and needed a cesarean. Malpractice was performed on the patient due to the lack of patient safety, responsible medication use, and effective communication within the healthcare team. It is important to remember that patient care involves a collaborative effort, and errors can have far reaching consequences on the patient's well being. Below will highlight the critical importance of these subjects. A cesarean section is a surgical procedure performed to deliver a baby through an incision made in the mother's abdomen and uterus. It's typically done when vaginal delivery isn't safe for the mother or the baby. Leaving a surgical instrument like scalpel blade inside a patient's body is serious medical error and can lead to complications such as infection, tissue damage, and internal bleeding. Leaving a foreign object like scalpel blade in the uterus can cause internal bleeding, which can be life-threatening. Prolonged bleeding and tissue damage can result in permanent damage to the uterus, potentially affecting fertility and overall reproductive health.
Proper protocol involving counting surgical instruments before the after the procedure to ensure that none are left inside the patient's body. These steps is crucial for patient safety and to prevent complications arising from retained foreign objects. Failing to follow instruments, counting protocols, and leaving the scalpel braid inside the patient's body constitute medical negligence. Legal consequences can arise due to this breach of standard of care, which result in harm to the patient. The doctor use of narcotics before the surgical and impair cognitive functions, including focus, judgment, and decision-making abilities. This could lead to confusion during the procedures, potentially contributing to mistakes such as leaving an instrument behind. Medication like narcotics must be used responsible and healthcare providers need to be in fit state to perform procedures safely. Any medication that might affect cognitive function should be managed carefully to ensure patient safety. Anesthesia and the sedations are critical aspect of surgical procedures. Proper administration and monitoring are essential to ensure that the patient's comfort and safety throughout the surgery. Patients should be informed about the risk and benefits of any surgical procedures, including potential complications. This helps patients make informed decisions about their health care.
Following surgery, patients require close monitoring for any signs of complications such as bleeding, infection, or pain. Proper prospective care can help mitigate the effects of error made during the procedure. Effective communication and teamwork among medical staff are vital to prevent error. Nurses and other team members play a role to advocating for patient safety and raising concern when necessary. Healthcare institutions should have systems in place for reporting and learning from error that promotes a culture of safety and continuous improvement in patient care. In our case, the principal factors contributing to the injury was the invert retention of the scalpel inside the patient's abdomen during the shoulder's cesarean surgery. This unfortunate event subsequently led to permanent damage to the uterus of the patient.
The healthcare provider was self administering opioids before the surgery, which led to noticeable confusion, cognitive impairment during the procedure. Nurse Ashley repeatedly entered the operating room, causing unwarranted distractions to the provider throughout the surgery. Following the surgery, the nursing team neglected to conduct thorough instrument count to ensure all the surgical tools were accounted for. and present. Towards the end of the surgery, the provider felt compelled to hasten the procedure due to the tight schedule as they were running late for the subsequent scheduled surgery. The healthcare provider could have taken an alternative like Tylenol before the surgery for pain, preventing confusion, cognitive impairment during the procedure. Anyone that wasn't in the operating room before surgery should not be allowed unless in an emergency situation to avoid unwanted distractions for the provider and for the surgery.
Following the surgery, the nursing team should have a mandatory instrumental account to ensure that all surgical tools were accounted for post-surgery. Toward the end of the surgery, the provider should have not hastened the procedure due to a tight schedule. The following surgery should have been rescheduled. The incident The incidence of RSB retained surgical bodies is between 0.3 to 1.0 per thousand abdominal operations, and they occur due to a lack of organization and communication between surgical staff during the process. Typically, the RSB are um, surgical sponges and instruments located in the abdominal retroperitoneum and pelvis.
A 40-year-old woman with a decade-long history of nausea, abdominal discomfort, occasional pain, and reduced bowel movements underwent extensive tests including blood work, ultrasound, and endoscopy, with no conclusive findings. A CT scan eventually revealed a left lower abdominal mass with metallic density, raising suspicion of a retained surgical sponge. The patient underwent laparoscopic surgery to remove the foreign body, leading to an uneventful recovery, and she remains symptom-free at the 1-year follow-up. Sarah Thompson, a 30-year-old pregnant woman, experienced complications during her pregnancy that necessitated a cesarean section. Tragically, this event evolved into a malpractice case due to lapses in patient safety, responsible medication administration, and effective communication within the healthcare team. This incident underscores the importance of collaborative patient care and the serious repercussions of deficiencies in these essential areas. It highlights the urgent need for preventive measures to ensure such incidents are avoided in the future, emphasizing the significance of safeguarding patient well-being.